Monday, October the 4th. We will get started with a quick update from Dr. Nessathuri, and then we'll move into media questions.
Great. Thank you so much, colleagues in the media, for allowing us to speak today. Just a few comments. One is that we recognize that the burden of COVID-19 is significant for the community of Windsor-Essex, but we also review our data on a regular basis and try to reevaluate our approach and strategies as a public health service. Today we'll be withdrawing the old letter of instruction and releasing a new letter of instruction. Fundamentally, the restrictions that were previously enacted on weddings and the restriction of hours related to bars, restaurants, and nightclubs will be withdrawn today, and we'll be reverting back to the provincial level of restrictions moving forward. So my first message today is that we're going to be modifying the public health direction and the additional restrictions that were placed on weddings, bars, restaurants, nightclubs are going to be withdrawn. The second is that we're going to revert to the provincial direction on these issues. Thirdly, and this is, I think, an important item as well, as we move forward, we really have to work on vaccination to the extent that we need to try to get a higher vaccination rate in the community. And secondly, also to work on vaccine verification and to ensure that individuals and institutions and establishments are complying with the vaccine verification requirements. The reason for this is ultimately to try to reduce the transmission of COVID-19. As we have reduced transmission, we hope that ultimately this will lead to even further reduction in public health measures. So with that, I'm happy to answer questions, or Nicole and I are happy to take any questions.
All right, thank you so much. We will start with questions from Windsor Star.
Yes, good morning, Doctor. Good morning, Nicole. Retracting the initial letter of instruction and implementing a new one, what was the change? Did we see a drop in cases relating to those businesses and sectors following the implementation of that initial letter of instruction? And do you feel confident going forward that the new protocol will maintain the level of cases or continue to lead to a drop in cases in those sectors?
Well, and I'm sure Nicole will supplement this, when the letter of instruction was originally promulgated, I think it was approximately 4 weeks ago, the case counts were higher. The burden of disease overall, looking at it from an epidemiological point of view, is higher than it is now. We always remain optimistic that the suite of public health measures will ultimately effectuate a reduction in the burden of COVID-19 on the community. It's always difficult to predict the future, but we have to do our very best, I think, to try to keep COVID-19 under containment, and containment continues to be the public health strategy at this point.
If I can just add that, so we, in review of our information, we, again, as Dr. Nessathuri said, our case counts have reduced, but we specifically looked at those sectors that were associated with the greatest number of cases, 4 weeks ago at the time, when we had close to 100 cases a day. And we have seen, we can't always attribute it specifically, there's lots of factors that go into it, but we have seen a considerable drop in activity associated with those settings. And then as well, what we do know is that those that are fully vaccinated, so environments such as nightclubs with the provincial restriction that only enable indoor activity for those that are fully vaccinated, we know that significantly reduces the risk of COVID-19, the risk of spread and transmission of COVID-19. So, we feel hopeful that will, lead us forward in a continuing in a positive direction.
Thank you.
Any questions from AM 800?
So, Doctor, I just want to make sure I have it right. So the 12 o'clock is no longer in place. Those establishments can stay open until 2 in the morning, and then dancing will be allowed once again?
Yes. We're reverting back to the restrictions that the province promulgates, and there are, for those activities, there are no additional restrictions in Windsor-Essex.
Nicole, just when this was issued 4 weeks ago, and I know we kind of asked you this question before, but I guess from 4 weeks ago up until today, I guess, I'm guessing a lot of emails, a lot of phone calls from individuals, business owners. Just talk about the last 4 weeks.
I mean, we always receive a lot of emails and phone calls. Certainly, we have as it relates to this particular letter of instruction, but I would say the business community has been overall very supportive, and if an adherence to those public health measures are, we believe was a big part of why we're able to, change them or revise them today. So careful review of our data and seeing a reduction in risk. So again, we can't do that. That's the community that has to sort of play a part. And so we're happy to be looking at our data, seeing that it has an effect, and with the change with proof of vaccination and reviewing some of our data related to that as well. We feel pretty comfortable, cautious, but comfortable moving forward.
Thank you.
Questions from CTV?
Yes, good morning. So how does this relate to weddings and funerals? What are the changes for those now?
So I'll start, as Dr. Necessary said, it will be reverting back to the provincial guidelines. So the Reopening Ontario Act sets out restrictions and rules for social gatherings, including weddings and funerals. And so in Windsor-Essex, will be aligned with those guidelines and restrictions. There won't be additional above and beyond within the Reopening Ontario Act.
Okay, thank you. And looking at the latest EPI summary, how do you feel that the region is doing with the key indicators? Did you expect to see it be more of an improvement by now?
Yeah, it's from my vantage point, the significant issue is that one is, as a global picture, the burden of disease is less now than it was 4 weeks ago. And whenever you make decisions of that nature, you have to consider all the data elements. That includes the number of cases, but that's not the only item. The number of percentage of people that are positive when tested, the number of people in self-isolation, the number of people that are sick, the number of people admitted to hospital, the number of people who have died. The number of schools that are affected by COVID, the number of class cohorts that are affected by COVID. And together you sort of formulate a picture of where you think the burden of illness is. I think the burden of illness today is probably less than it was 4 weeks ago. But I also think that when looking at the 34 health districts, Windsor-Essex is still probably one of the most affected health districts in the province by looking at some of the data elements. So we always hope for the very best moving forward, but we're cautious in our determinations, or cautious in our assessments, especially with predicting things that might happen in the future.
Okay, thank you.
Any questions from CBC?
Yes, speaking of last week's EPI report, there was a brand new slide in there showing COVID-19 symptoms for adults versus children. And it showed that there was a lower proportion of youth experiencing almost every symptom compared with adults. I'm wondering what you want parents and their children to take away from that information.
Well, and I'm sure Nicole will supplement this, but the most important thing is, if your kids are sick, keep them at home. That's the bottom line, because when you look at that slide, it has interesting scientific value, but for me, the real issue is that COVID presents with a constellation of symptoms, and some of the symptoms are typical, and some are what we would call atypical in medicine. If your children are not feeling well, keep them at home, and don't let them come to school. So that would be my core message from that slide. Nicole, maybe you could supplement my comments.
Yeah, I think, what we want to do by sharing presenting symptoms is also just being able to share with the public what I think the symptoms have been out there all along. Individuals should be doing daily screening and crossing through those symptoms of COVID-19, but I think sharing that information we hope is helpful. And again, we're just continuing our message of don't ignore. I think, it is allergy season. There's a number of other things that are going on, and we just stay home if you're sick, and certainly get tested if you have any of the symptoms of COVID-19. And sharing the presenting between adults and children will help give parents at least a little bit of idea of what are some of those common presenting symptoms for the children.
Thank you very much. And switching gears entirely, the Spitfires, they'll play their first season opening game this week. I'm wondering what exactly public health, whether you have an enforcement role at that game and throughout this season. I assume they've submitted a plan to public health, but yeah, if you could please comment on that would be great.
So, public health has had an enforcement role throughout the COVID-19 pandemic. We do, as well as any provincial offences officer, we do enforce the Reopening Ontario Act. And as far as safety plans, if that's what you're referring to, so, all businesses are required to have a safety plan, including sports and recreation. We don't approve, so the health unit isn't in the position of approving safety plans. We can certainly guide and have many tools on our website as well. Businesses and associations can call in, and they'll be supported by a public health inspector to ensure that they're, have all the elements that they need to have within their safety plan. There are some additional tools as well that have been put out by the Ministry of Labour that make it even easier for organizations and businesses. As far as enforcement goes, again, we do respond to all complaints that come to us. We work with our enforcement partners to respond to those complaints, and we also will, do proactive education and enforcement as well.
But can you speak to whether there will be proactive enforcement, regularly expected at the games this season, or?
At hockey games? Enforcement of what specifically?
Vaccine mandate, other public health protocols.
Yeah, so the proof of vaccination specifically falls certainly to the business, to the recreation facility. So for WSCU, we would expect that they're enforcing and have all the protocols in place. But we don't have a specific enforcement strategy, for the Spitfire games. But again, we will respond to complaints and follow up with businesses to ensure that they do have everything in place that they need to have to ensure that they're following proof of vaccination.
Thank you very much.
Any questions from Blackburn?
Yes. Could you remind me what the province allows for weddings and funerals? What is it under the ROA that's what the restrictions are?
Well, there's several sections that cover weddings and funerals. So there's a social gathering associated with a wedding, such as a reception, that has different instructions. And then there's a service or rite, which has another set of rules. So those can all be found. There's social gatherings associated with a wedding and funeral that's limited to 25 people indoors and 100 outdoors. There are some exceptions to that social gathering limit, and that's for those, receptions or social gatherings that are held within a conference center or meeting and event center. And I believe that the capacity is 50% within those facilities.
Okay. Also, I wanted to ask you about today you're withdrawing the letter of instruction for bars and restaurants and for weddings and funerals. But what about for the extracurricular activities for school boards? Is there any movement there on the recommendation you had for them, whether they can start up again?
Well, you know, uh, ma- is it okay if I speak first, Nicole? Yeah. So when you think of the burden of disease, the number one goal in my mind, I think from a public health perspective, is to try to keep schools open for instruction. And we know that COVID-19 is transmitted by human to human interaction, people in close confines. We also know that the spread of illness is more likely when there are more people traveling from place to place. So given the fact that the burden in schools is quite significant, vaccination rates among young people is lower than we might expect. We also know that the number of cases and cohorts that have been dismissed is quite significant. I believe, and Nicole can give us the exact number, or we can get you the exact number, that I think we've dismissed more than 100 cohorts of young people in this school year, and it's only October. And all of last year, I think, go ahead, Nicole.
More than 200, actually.
It's now more than 200.
Okay.
So we've dismissed more cohorts in this first month or 5 weeks of school than we did all last year. So given all of that, I think we have to maintain a level of vigilance to try to prevent COVID transmission at schools and try to minimize the chances of school outbreaks. So with that, we're going to continue to recommend a pause on extracurricular activities at schools, and we'll work closely with the school board, which I think shares very much the same goal, which is to try to keep schools open for instruction. Nicole, I hope I captured all the key points on that.
Okay. The other question I had was about working on the vaccination rate. This has been a stubborn one since we've started. And I guess you mentioned this morning about how we really do need to work on that. Aside from what you've said, what more can you do?
Yeah, no, it's clearly a challenge for sure. I think that at this point, it's really for parents and young people to participate in improving vaccination rates. I think the numbers are among young people who are, I think, 12 to 18 or 12 to 19. It's about 60-something% who are vaccinated. If we look at other vaccines which are required for school-age young people, it comes to around 90%. So the gulf between those people who are vaccinated for COVID and those who are vaccinated, let's say, for measles is quite a bit. And if we can get up to the measles vaccination rate, then I think we would have better control of, we would have less burden of disease in schools themselves. So I think that that is something to consider. I think the province has to consider at some point, do they choose to make the COVID-19 vaccination part of the suite of vaccines that's required under the Immunization for School Pupils Act? That's the statute that facilitates the vaccination of individuals who attend school. But I think that's a matter for the province to consider, and I believe that they are considering those options even at this time.
Would you be in support of that?
Yes.
Yeah. Okay.
Yes. Well, and if I could just expound on that, we're in probably the most significant pandemic in my lifetime in medicine. It's the most significant pandemic. This is probably the most significant public health issue in my 30 years of practice. It has widespread effect throughout the community. We have a vaccine that is effective, and we have schools that have been closed, and Windsor-Essex has been particularly disproportionately affected by school closures. So everything in public health practice is managing risk and managing the risk versus the benefits. And any reasonable approach that ultimately brings vaccination rates higher is likely to reduce transmission in schools, and with that, we're likely to have a greater chance of keeping schools open for instruction. So if our goal, which I think is a goal that's shared by almost everybody, if our goal is to keep schools open for instruction, then we really have to use every approach that we can to try to get vaccination rates higher. And it is something we have to do quickly, because even if we vaccinate somebody today, it'll be 6 weeks before they're fully protected from COVID-19. So in a nutshell, I think that's something that we have to consider as a matter of public policy. It's a decision that the province has to consider and effectuate moving forward. Nicole, do you want to add to that? I'm sorry, I think you had wanted to say something, but.
No, I think you covered it. Thanks.
Thank you very much.
Any additional questions from Windsor Star?
Yes. Excuse me. Yes, you mentioned that you will continue to recommend a pause on extracurriculars in schools. Have you decided on a new date at which time you may reevaluate that decision?
Yeah, you know, we constantly evaluate the data, the facts and circumstances, and try to make decisions as best as we can. And that's on a regular basis. We've not made any specific determinations, and but it's very difficult to predict the future. And you know, as doctors, we really are reluctant to say what the future holds. So I think for now, we, based on our current experience, we keep the recommendation that extracurricular activities are paused. As the burden of illness and the burden of disease is diminished in the school community and the community overall, we can reevaluate what level of restrictions that might be recommended.
Thank you.
Any further questions from AM 800?
Doctor, just for the letter of instruction being lifted, does that go into effect immediately?
Yeah.
Perfect. Thanks, Nicole. And then one follow-up for Nicole. Nicole, just in regards to the school closure in McGregor, the French Catholic Elementary School, just seems like the cases are growing at a rapid pace. Last Monday, they were at 1, and I think midweek they were at 3, and now they're at 13. I know obviously it's a concern, but just seeing that number grow, are you worried it could continue to grow?
Yes, certainly we are worried it can continue to grow. You know, there has been some proactive testing, so we'll continue to look at our data and continue to work with the school board. But anytime we see a number of cases within a school environment, it's cause for concern for us.
I'm not sure if you can tell us this, but is this age group that is seeing the cases, is it individuals that cannot be vaccinated, or is it in the higher age groups where they can be vaccinated?
I think majority of our cases are within age groups that are not eligible.
Thank you.
Yeah, if I could supplement that. Ashley, is it okay if I supplement that?
Yeah, definitely. Go ahead. Sorry.
So a couple of things to think of. One is that one of the reasons we vaccinate, try to encourage vaccination of everybody, is to prevent the transmission from people transmission to people who are unvaccinated but ineligible for the vaccine. So, and what we're seeing, I think, as a general construct is that unvaccinated young people, especially those who are ineligible for vaccine, are particularly at risk, and we want to try to do our best to minimize the transmission into that group. The second issue is that whenever we get an epidemiological signal that there are cases, we want to act quickly on the Public Health Service, working closely with the school board to try to contain it. So as best as we can, if there's a case in a particular class, we want to identify that class and dismiss the close contacts so that hopefully it won't spread throughout the school. And so that's been our strategy up to this point, which is to try as best as possible to limit the number of cases within schools. Testing is a helpful strategy, among other things, to understand how widespread COVID might be in a particular school. So it's sort of a strategic risk management and containment decision to test, isolate, and to reevaluate.
Thank you.
Any further questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
And Blackburn.
Nope, I am good. Thank you very much.
All right. Thank you, everybody. We will meet again on Wednesday morning. Have a wonderful day.